All right, so we'll go ahead and I understand Commissioner Paul said most of that has to go first. So I'll go ahead and take it away. Well, I appreciate the opportunity to come and share our State of the County address with all of you. We have been going around the county doing this address. Kicked it off in Salem, and we've been north to Woodburn, and we've been to Silverton and Jefferson. And so I can't remember, is this the last one?
No, Mill City.
Mill City is the last one that we have coming up. And one of the things that we comment on, I don't know if I got my top here, but you have it at your table, is that, first of all, we asked our department heads to let us know kind of what their accomplishments were in the last year. And they came up with this 16.5-page document, which we hardly even scratch the surface of when we're making our remarks. So this really tells you Marion County is very diverse, has lots of different departments, does lots of things, and we can only really get to highlights of a few things in the State of the County address. The second prop that I have here is this tabloid, and I'll refer to it on a couple of items that I'm going to talk about today. So I have 5 topics that I'm going to talk about, and several of them relate to the Oregon legislature, which is in session. And the reason that I get to go first today is because I apologize, but I'm going to need to leave around 12:30 because I have to be at a hearing that starts at 1 o'clock back in Salem, so on a bill that deals with school zone signs. So if you want to know more about that, I can tell you about that another time. So the first topic is healthcare transformation. That legislation passed in the 2011 and 2012 sessions. And I serve currently on the board of Willamette Valley Community Health, which is the new coordinated care organization for Marion and Polk counties. We are focused on about 66,000 people that are on Medicaid, or what they call the Oregon Health Plan in Oregon. So these are people who are in low income and can't afford health insurance, and this government provides health insurance for them. The goal of the initiative is what they call the triple aim. So that's better health for people, better health care for people, and to lower the costs. So we've been meeting every other week since last spring, and I'll have to change this line on my speech because I just got an appointment. We're going to start to meet once a month now. So that is, but since a year ago in April, we've literally been meeting every other week to try to form this new coordinated care organization and figure out how we're going to stay within budget and design health care. We've approved an operating agreement. There's a board of directors. There are 11 members that they call capitalizing members, and those include 4 hospitals, including Santa Ana Memorial Hospital, the WBP Health Authority, which are the doctors. They're affiliated with that. There are several clinics like Salem Clinic, the Yakima Valley Health, which has the federally qualified health centers. So those 11 members actually put funding in for reserves because we have to operate as a health plan. And then there are 2 county commissioners, one from Marion County, myself, and Craig Polk from Polk County. And then there are some public members that represent business, the medical field, and so forth. There's also a Community Advisory Council, and that is required by the statute. It's chaired by Patrick Vance, who also happens to chair our Health Advisory Board for Marion County and our Budget Committee for Marion County. So he's very tightly connected with Marion County. So it's really going to change the way that health care services are delivered in the sense that they're trying to integrate physical health care, dental health care, and mental health care. And up until now, mental health care was run by a mental health organization, and so there were a whole array of providers that did mental health. Doctors provided physical health care, obviously, and then dental providers dental health care. But for example, if you're somebody who is mentally ill and you go to the doctor, you could actually get your medications at the doctor's office rather than getting your medications from a mental health provider. And there could be a behavioral specialist in the clinic who could help you with some of your mental health issues to assess or whatever and make sure that you get the services that you need. So those are the kinds of initiatives that we're looking at to try to improve health care for people who are on the Oregon Health Plan. The second topic is early learning. So legislation passed on early learning in 2011 and 2012, and there's actually 2 bills being considered right now by the legislature, House Bill 2222 and House Bill 2013. So we're trying to sort out how we provide services for families who have young children and may be at risk. They may be in poverty, their children may have developmental delays, and the goal is for those children to be ready for kindergarten when they arrive in school and to be able to read by the time they leave 3rd grade at grade level. The reason this affects counties is that for the past 20 years, we've had commissions on children and families, and that's actually where I met Karen, was in Curry County on that Commission on Children and Families, and they were responsible for doing comprehensive planning and coordinating services for children and families of all ages. The local commission system actually sunsets on January 1, 2014 with a bill that passed last year. And there will be new regional early learning hubs that are created that are to coordinate services for families with young children. And then there's a State Youth Development Council that will coordinate services for school-age youth up to age 20. So for the past year, I've been working with providers of early learning services. We've had a stakeholder group and have developed a list of recommendations about how services might improve in the early learning system. These include things like home visiting, child care, Head Start, early intervention, early childhood special education, mental health services, connections with physical health services, which we just talked about. And then so as a county, we're also looking at how we're going to transition our local commission on children and families. And I think Sam, who serves on that commission, will talk about that a little bit in his remarks. The third topic that I want to talk about is prisoner reentry, and this is something that I've been working on for the past, I say several years, but actually I've been working on it, I think, since about 2008. No, maybe more like 2006. It's been a while. Anyway, so Marion County has developed, since 2005, actually, some strategies to deal with people who come out of prison back into our community. So we have roughly 600 people a year that come out of prison back into Marion County. And we have under parole and probation about 4,000 people that are being supervised right now, which a lot of people don't realize. It's pretty staggering to think that it's that many people. The marker in terms of whether we're successful, kind of the big outcome that people look at is something called recidivism, and that's whether when someone comes out of prison, do they commit a new crime, a new felony crime within 3 years and go back into prison. Our recidivism rate back in 2006 when I started working on this project was about 33%. And that's kind of average, about a third of the people that come out of prison go back into prison. With the programs that we've been able to work on, and Chemeketa Community College has been part of those programs, the health department, obviously the Sheriff's Office Community Corrections Division runs all of those programs, a program called Mid-Valley Mentors that provides mentoring services, and Community Action that has a reentry resource center in Salem, along with some transitional housing. We have actually been able to drop that recidivism rate for the general population to about 17%. So it's gone from 33% to 17%. So we know we're doing some things right and going in the right direction. For the wraparound services that are provided, they're a very intensive program for about 100 offenders each year that go through that. For those folks that go through that Chemeketa-based program, the most recent recidivism rate we got for that group is 8.5%. So again, what it tells you is that if people get the right supports coming out, if they get cognitive behavioral therapy and substance abuse treatment and employment skills and connections to get housing, and they even take parenting classes in our intensive wraparound services, that it makes a difference and that they can pay their debt to society and come back into society and be good fathers, good mothers, good spouses, taxpayers, good employees, and so on. And that's really what we would like to see in our program. We're in the third year of implementing a Second Chance Act grant from the U.S. Bureau of Justice Assistance, and Marion County was actually selected as one of 7 sites to be a national demonstration project. So we're being evaluated through a national evaluation with 6 other sites and are getting, again, very good data out of that. Fourth topic I want to talk about is our budget. And there is a lovely article in here called Where is Your Money Spent? With a pie chart. And it shows you that our overall budget in the article, it says it's $352 million. This is for the budget that ends on June 30th of this year. Out of that, our county general fund, which is the part that comes mostly from your property taxes, that is what we call our discretionary dollars. We choose how we spend those, where the other dollars are Medicaid money or road money or solid waste money, so we don't really get to choose where those dollars go. But out of that $78 million, we spend about 76% on public safety, which includes the Sheriff's Office, the District Attorney, the Juvenile Department, and the Justice Courts. So that's, when we say we prioritize public safety, and Commissioner Milne will have many remarks about that, we really put our money where our mouth is, so to speak, on that topic. In the budget that's coming up, our budget officer, we haven't really started our budget hearings yet, but he tells us that it's going to be pretty much a status quo budget. Obviously, the PERS issue creates challenges for us. We're going to see about a $3.2 million increase in our budget because of the increase that we have to put in for PERS. Our healthcare costs, although we had a really good year this year where our staff was able to negotiate a zero increase, over the past number of years, just like businesses, healthcare costs have increased. And our contribution per employee for healthcare costs is double what our contribution for PERS is, so that gives you some perspective there. We have 5 unions that we need to negotiate with. We were negotiated with 3 last year. One of them was a little bit interesting. We have 2 that we're working with this year, so that is always a consideration in terms of how it affects our budget. And we are looking forward to savings when we move back into Courthouse Square in, the date is supposed to be May of 2014. We're spending roughly $870,000 a year on leases around Salem because we had to move out. And so we'll be able to save those costs when we move back into Courthouse Square, which is my last topic. So another article in the tabloid about Courthouse Square, and it gives a lot of detail. We also have a lot of information about Courthouse Square on our website, some videos on YouTube that you can watch if you're interested in actually seeing the presentation by Structural Preservation. We actually made a decision as a board and as a transit board, so Salem Kaiser Transit is jointly owns the property with us, and so we make those decisions jointly with them. So in April of last year, we made the decision that we would repair, or what they say remediate, Courthouse Square. We signed a contract with Structural Preservation Systems in September 2012. They have excellent credentials. They are a national organization out of Baltimore. Their specialty is really dealing with buildings that are failing and need to be repaired. They've done LaGuardia Airport, Union Station in Washington, D.C., the Guggenheim, so some pretty major projects, and we're very pleased to be working with them. They are using local architects, local construction folks, but they are engineers and their staff are overseeing the project. So the construction work started in November, and again, our estimated reopening is May of 2014. So those are my comments, and we'll turn it over to Commissioner Milne and then Commissioner Brentano, right? And then we'll open up for questions. And I will sneak out of here a little bit.
So if you have a question for Commissioner Carlson, now's your chance while she...
Oh, yeah, Kurt.
Thank you. Thank you again for allowing us to be here and share some time with you. And as you can see just from Commissioner Carlson's comments, there's so much that happens at Marion County, and there's a lot that each one of us is involved in. And it's just, and I'm going through my notes here because we started this back in February, and so much has happened just since we did our first State of the County presentation. So I was looking at my notes thinking, well, do I really want to talk about that? Or I need to update. So I'm going to do some updating off the top of my head. The areas that I'm going to talk about are economic development and public safety. And I've always said, and if you've heard me before, the two go together. You can't really have one without the other. We want to have healthy communities and safe streets. Then it's important to have a good, solid law enforcement system. That requires money, and as Commissioner Carlson said, we do devote 75% of our money to that. But what's also important in community livability is how we work together at Marion County. When we work with community groups, when we work with other government entities, when we work with nonprofits, and on and on and on. It's just ironic in the last couple of days, today's only Wednesday, so far this week I've been to 2 meetings where everybody talks about collaboration and how wonderful the partnerships are, and I'm here to tell you that that's true. And I know from many of the things that you do here in your community, you know that's true too. We can't do anything by ourselves. As Rotarians, and I am a Rotarian, we can't do anything by ourselves. It's how we interact with others and cooperate. So the 2 groups that I work the most closely with, Economic Development Advisory Board at Marion County, I'm not a member of it, I don't sit on it, but I do keep close contact with it because that is an area too. I do sit on the SEDCOR Board of Directors and the Executive Committee, and there's a lot of close communication with our Economic Development Advisory Board and SEDCOR and many other community organizations. What I'm always so impressed with is how smart. So many people who get involved in things, what people bring to the table, and then what a group ends up sharing and talking across the table and the ideas, the solutions that really can hit the ground running and make a real difference in the community. And an area that's very, very important to all of our communities in Marion County and in our region is agriculture. And agriculture is Marion County's #1 industry. In farm gate sales, the most current information I have was in 2011, and the farm gate sales are more than $616 million. And we do lead the state in agricultural sales. Clackamas County is a close second behind us. And in the meeting I attended last night, Mayor Anna Peterson, Salem Mayor, put together, invited a number of people to come together to talk about how we can do more to push agriculture, and how we can, it kind of boils down to how do we sell this tremendous industry. It is our basic industry, and so many businesses here in Staten, you go across the highway there to Sublimity, you go to, and I live in Woodburn, I look at what's in my community, and almost every business is connected in some way, shape, or form to agriculture when you really stop to think about it. It might be farm sales, it might be your local bank, it might be insurance agents, and of course our local schools are so involved in it too. So it's been a huge issue for me over the years, and I know it's not easy today for farmers to be successful in farming, to be productive, to make a profit. We know many areas of farming have been hit very, very hard as the economy turned down, particularly anybody related to landscaping businesses knows that. So what can we do to encourage agriculture and to help our farmers make life a little easier for them? Because it's an industry that's ever evolving and ever changing, and it becomes more and more difficult. It's more about a lot of other things than just farming today, just getting that plow out there in the field. So at Marion County, to try to encourage farming and show our support to farmers and those in ag-related businesses, we commissioners passed in January a resolution declaring the importance of agriculture to economic development. And I had previously spent many, many years, but more specifically on this, several months, and talking to farmers, talking to ag-related business owners, the Farm Bureau, and many others, and of course our cities and our communities. And this resolution has been so well received. It just surprises me. I mean, I thought this is a great thing to do, to tell our farmers and those involved in ag-related businesses that we are here to support you. We value what you contribute to our local economies. But the reception we've had, the response to the resolution has really been overwhelming, not just from farmers and ag-related people, but other community organizations saying, yeah, this is great. So just last night, in fact, I was at the most recent of the Mayor's Ag Forum, and everybody sitting around the table, and one of the interesting things that was said just last night is to grow an economy, you have to grow an industry. And it's like, well, yeah, sure, we all know that. But unless people can sit around a table and start sharing these ideas and kind of reconfirming with each other the importance of agriculture and how huge it is to our local economies, we kind of take it for granted, I think. We go, well, yeah, we know there are all these farmers. So there are a lot of things happening, and it's all about that collaboration that's so important. There was an economic development summit held last October that our Economic Development Advisory Board sponsored. 120-some people, private and public sector individuals came. It was a huge discussion. Was anybody here? I'm looking, I don't think anyone here attended, but there may well be one again next fall, so think about that. They came up with a lot of recommendations and some priorities for the next year, the coming months, and the majority of them centered around the importance of agriculture and how we ought to spend more time on developing expanded ways for agriculture to grow. So having a lack of time to get into some of those details, maybe I can come back and talk about it more later. Relative to public safety, safe streets, livable communities, as I said, really helps grow our communities as well. There are a lot of things that are done really, really well. The local police department does a great job. You have a great chief, and you have a pretty safe community. But it doesn't just happen by itself. And unfortunately, I want to just touch on a couple of very, very sad statistics and just remind you of some of the things that we're working on, both in the Public Safety Coordinating Council, the Children and Families Commission, and all of our local police agencies. One is the horrible rise in the number of domestic violence cases. And there in January, since January of 2009, there have been more than 140 women and children murdered and victims of domestic violence. Just this morning we talked about child abuse. We signed a proclamation. April is Child Abuse Prevention Month. It's also Prescription Drug and Heroin Abuse Prevention Month. So we take these very seriously, and again, it's a collaborative effort, and Sam might talk a little bit more about that. We continue to be out in front against fighting meth, and along those lines, and that's largely through our Public Safety Coordinating Council, but not exclusively. And we are having our 8th annual Striking Out Meth in Marion County event, July 26th, and I know this Rotary has helped sponsor this, and so I'm hoping that you will decide to do that again. And I left with you too, there's a sponsorship form here. You can see there are 2 pieces. We have what we call regular sponsors. Individuals can be a regular sponsor or a bleacher buddy. However you decide you want to do it. The difference is the Bleacher Buddy sponsorship money, every single penny goes directly to bringing foster children and foster parents to the event so that they can experience everything that goes on there. The sponsorship money for the regular sponsorship goes to, we have printing, we have t-shirts to print, we buy baseballs that are souvenirs that the kids get later, we have a passport that gets them out and about for all our participants throughout the event. So I hope you'll consider that as a club and also or individually. Sponsorship started just $100. Then in closing, let me just say too, with regard to the prescription drug abuse, there's a project called Drug Safe. And are you going to talk about that, Sam? And so Sam will give you that. Another thing we're focusing on through Public Safety Coordinating Council is highlighting and trying to bring more support, more encouragement, more community awareness about our veterans. We have thousands of veterans who come back to just Marion County regularly, and through our Public Safety Coordinating Council, we want to bring that awareness. Last October, through our court system, a veteran treatment docket was begun, and that's for our veterans who interact and maybe they have some abuse, drug or alcohol or whatever problems. And this court, it's kind of like you're familiar with peer courts and whatnot. Well, it's on a higher level, but it's so specific to veterans so that the judge and the system can really get the veterans to the services and the programs that are so specific to their special needs as a veteran. And I have veterans in my family, and thank you. Luke is currently serving. So we're focusing on that, and then just recently the Marion County Board of Commissioners put its support behind, gave it its blessing to become involved in an effort called Joining Forces. It's not a county program, but I'm going to be able to sit on that group, and it's going to again be pulling programs and services and collaborative efforts so that we can highlight what's available for our veterans, support our veterans and their families. So one final thing, I want to share the good news that our sheriff, Jason Myers, was elected by his peers as the Sheriff of the Year. So, and he's a local guy here. So we have lots of good things going on and lots of challenges. So I'm going to turn it over to Sue.
You know, I gotta tell you, I'm coming off the worst miserable 2 weeks of my life. You can hear a little in my voice. It's really important to Mike, because he likes to watch me and gather material so he can mock me in other venues. So I just want you to know, Mike, this might not be representative today. Just kind of use what you want, but just, you know,
I'll take note.
it's contaminated material. You know, it's funny that Patty brought up about the change and what to use in her speech, and she's changed it quite a bit. I actually, driving here, thought, you know, I should have rewritten. All the things that I've said are fact, and 6 weeks change. And maybe that's what's interesting about county government, how dynamic and changing it is, and you deal with things, and I guess you have to be flexible. So I don't know if I can make this work, but what I'm going to do, if I say I told people at different places that this was a fact, that'll be your clue to know something's changed. We'll see how this goes. We look, you know, our State of the County is supposed to be a look back in 2012 and kind of a look forward too. And Commissioner Carlson talked about courthouse score. That was absolutely the biggest decision we made in 2012. When people stopped me, it's still I'll say Tad Humphreys, you all know him. He said, Sam, that was a bad decision. I said, you know what? I don't think it was. I think we found a way to save the building at a reasonable cost, and I think it was the most important and best decision we made. And what I told him at that time, this is where one of the first little changes is, you know, any project can kind of take longer, and I've been saying everything's right on track, but there's little hints that they're going to find things as they get into it. But right now, it is still on budget, still on track, and we'll begin to really working hard to, yeah, I feel it, working hard to make sure it stays that way. We kind of break the county business up 3 ways. I like to say it's by expertise. In my case, it's at least interest. And the ones that I deal with mostly have been children and families and public works. And now the Oregon Garden. So I'm going to just have a few comments on those. I'll start with children and families. It's really been an important group. We have representatives from all over the county, mostly school-oriented, but a good diverse group of people that meet and deal with problems. We've dealt with, you know, foster children, their problems, and whatever comes up. Unfortunately, our legislature cut the funding. It's going to change it to a statewide program, which it's so evolving. We had a board meeting a couple of weeks ago. They're going to have hubs that involve regions. So instead of having a county focus, you kind of have a regional focus. But in reality, it's just the way the state sucks up the money and doesn't put it out on the streets where it really does any good to anybody. So just watch for that. So we're in such a transition year. The county is, we're going to make our state commitment. We roughly put a couple $100,000 a year county money in support of Children and Family Commission. We're going to keep that. We're going to keep that framework. We're going to keep these people together, but it might be more ad hoc or special needs. And Patty talked about this drug safe one. There's going to be 2 seminars. We're trying to get one up in Staten, and that hasn't come together quite yet. But the subject is, and it gets real personal, but deaths in Kaiser. People are getting addicted to the opiate drugs, Oxycontin, Percocet, I don't even know the names. And a couple different issues. One, making them available to their kids, and that becomes a great Saturday night to meet together and pull up what you grabbed out of the box. And then, of course, the addictions that happen very quickly, apparently. So it's an awareness thing, and I think it's going to be a real eye-opener for the community. So I hope we can get this going here. And then how to take care of these drugs. Every time I talk to people, just think about it. You go to the doctor, I just went, and I won't get into that. But, so I got some stuff that I'm not going to use. Well, so you put it away. Well, you got to dispose of that as part of it. What's happening, though, in these opiate drugs is kind of eye-opening to me. It's become a gateway to heroin because it's easier to get heroin than it is these prescription drugs. And then once you get into that, and the young girl just died in Kaiser, it's kind of right where we go. Started with that, just normal people going out somehow, and we're going to make awareness and try to cut it off. So in children and families, we're going to try to keep it going, but it's going to be harder to have the big impact that we have had. the Oregon Garden, county has a big investment there. It's successful, it's well-known, well-loved. The resort itself is doing well. But I got put on the foundation this year. And I've been involved in foundations in the past and like them, but this is different than anyone. It's a lot harder. We're trying to gather support and resources to do the extra things as things break or do events to keep it fresh and going. So, and then what happened, and I was there, I don't have any excuse, but nobody'd raise their hand. It's time the chair quit, so they're looking for the next guy. Well, here I am now, I'm the chair of the Oregon Garden Foundation. I'm not saying it like I don't like it, because we've done good things already. But one of the biggest is from, excuse me, I started hurting here. The board made an agreement with lottery dollars that we have access to for economic development to make a 5-year commitment that's going to really help the foundation do its job and then help the garden. So watch for events there. There's one we're planning, and I guess I've said in the past is we're talking about it's premature, but we are now planning a big Christmas event there. I hope it becomes an annual thing that people really enjoy, kind of a German Christmas village. Lights, kind of a grotto event with Dirk Winters, the operator of the resort, has a facility in Cambria, California, where they did this last year and was hugely successful. So watch for it, and businesses here may want to be involved. And I think it has a lot of potential of bringing people to the garden, especially in the off season when you really need them, and making exposure. So I'm really excited about it. I do want you to watch. I spend a lot of my time with Public Works. I'm already getting a little bit longer. I like to, roads are always an issue. I kind of give a report. My gauge is I'd like us to be doing overlays on 50 miles or 5% of the county roads every year. And I've been a commissioner for 9 years now. I don't know whether that's happy or sad. It's surprising to me. But in those 9 years, we've had a couple of years with zeros, some sixes, a 9. This year we did do 42 miles. But I'm so worried. Gas taxes aren't keeping up. Gas taxes provide kind of enough money to fill the potholes, keep the shoulders up, but not really to keep it up. So when these overlays become all important, because if you don't, the roads actually break down, and then what's hundreds of thousands of jobs becomes millions. And we're kind of getting into that right now on State and Jefferson Road. Public Works is going to try, you've heard it or seen, where they go in and grind it up and then relay it. And we're getting our own machinery to do that in a section of State and Jefferson Road. I don't know exactly where, but I can picture some spots. Normally you'd have to be replaced, and we're going to try to do that to get going. Where am I going to go to? That's enough for roads. Well, I'll get into it. Bridges. One of the places where I told people that there's no money for bridges, and yet I'm happy to report this time we've had some good luck. We have Public Works is always also emergency services, so I'll blend this in a little bit. The only big event we've had in the last year, so now a year and a half, was the flooding in January of last year, of 2012. And there was, of course, a lot of flooding here, but Almsville and Turner especially. Well, what happened is a bridge went out. It's called Whipper Road. It's over an irrigation ditch. And you don't think it affects much, but suddenly, people are stranded. There is another long way around, but emergency services. Well, we really, part of why we're here today, we like to get out in the communities. And we had our board meeting in Turner, and speaker after speaker was just saying, gosh, if there's anything you can do, this is just killing us, this road. We have to get it open. So we kind of all resolved among ourselves, let's talk to Public Works to make it a priority. Our county engineer was able to find some money to fix it, and even better, to replace it. But this is what I'm telling people, that there is no more money, and that's why it was so good. But our bridges in Marion County, I think I'm wandering a bit, but stick with it, nobody's yawning yet. We have 150 of them in Marion County. And a lot of them you don't even know they're bridges when you go over them. And there's more, again, another 100 culvert kind of situations. But let me tell you, $1 million doesn't go very far. A couple truck lengths, I guess, when you're talking about bridges and the obstacles to working. You only work in season, a number of different agencies have to sign on. In the past, we've had you could apply for some federal money to replace your worst bridges every year. Every county could kind of count on it every couple of years. Well, that money now is just a few $1 million competed by all 36 counties in Oregon. So I haven't had any idea what we're going to do. And we've had a couple of bridges that we have 150 of them, they're rated 0 to 100. Most of ours are 75. But we got some in the 30s. Now, you're getting kind of close to where you probably shouldn't really be driving on them. One of them's a key one. It's right outside of our county shops on Silverton Road, and another on Jefferson Marion Road again. And good news, our county engineer has found some money to get those replaced. I still say, I don't know how we're going to take care of the infrastructure that we have, not just this county, but all counties. Monies are drying up. I mentioned gas tax monies that we've used in the past have been timber revenues. And if you've seen any of the news, those monies have dried up. Southern counties it's just a desperate situation. They truly required, if we have $75 million from property taxes, you know, like 2/3 of their money, instead of being property tax, came from those, and that's gone away. And they're talking about, you know, actually bankrupt counties and law enforcement. It's 75% of our what we call discretionary money, so it's one of the first to suffer. I serve on a committee with commissioners from the ONC counties, and I just hear them innocent talking of when you call the 911, nobody answers, nobody comes. The case that they were not laughing about, don't get me wrong, but a mobile home being stolen out of somebody's driveway, and nobody comes, nobody cares. So it's really a bad situation. I have a couple. I've been going over not mentioning parks. I've kind of hit on emergency management. Parks has been an interesting thing for us. We have 20, 30, I don't even know. And most of them you wouldn't think of parks. I'm sorry. They're just kind of mowed areas. And what happened is typically a developer had to set some ground aside to with a subdivision, and then turns it over to the county, and there it sits. But we have made some gains, and two that I want to highlight, one because one affects us pretty close here. The county's got the last money for, we'll have our own campsites actually on the Little North Fork, and it should provide some wonderful opportunity for residents. It's still to be developed, 6 to 12 sites, but that's the first time we've actually had campsites, and we'll be announcing that. And then the county did something kind of unique, but it was a park called Santana Park in East Salem, just very much similar to what I just said, a park that's their neighborhood park, but we kind of mow it, maybe a little basketball court and broken down rims. And the local people came and said, you know, well, one had actually been doing mowing and cared that much for years, and came and said, we'd like to put a foundation together and gather resources to really step the park up and make it something we're proud of. So over a period of years working with them, that we've transferred that over. It's still open to the public, but it's been a great source of community pride, and I'm really happy to say it looks nice, and it's really being used. I'll wrap things up. We've had some bright spots. Woodburn Interchange, Mike, you care about that. Commissioner Milne worked on it. She said for eternity. I know it wasn't quite, but it's finally being done. If you drive through there, you're going to see. The bad side now is that it's about 3-4 years of construction interruption, and it could affect you if you want to get through there, or get to Outlet Mall, perhaps St. Paul. So you're going to have to start getting off at Jervis and learning those roads, because the county will be getting things up. We're working with the city and the state, City of Woodburn State, to let people find alternatives and try to minimize usage of that as it's being built. But that's a pretty big plus. Now this is one of the big change things. You know, all you know me in my true light as a garbage man. I still get to be involved in garbage and recycling. So what I've been telling people is it's all good news. We had the highest recycling rate in our history, 3rd highest in the state. And I know that it's only the 3rd highest because the others cheat, and there's just no way. But we do everything right. We recycle everything we can to begin with, then what's left goes through that burner, and magnets pull metals out. And then our next project the county took on was one that I've really been happy with, and this is where things change a little bit. Though we noted a lot of metal still in the ash there at Woodburn. If you see those piles by the truck scales, that's the ash from 25 years of operation of the waste energy facility. Well, we've been going through and sorting it, pulling more metal out, and it made it, finally got permission from DEQ to use it as daily cover at the landfill at Coffin Butte and Corvallis. And that's just huge. That's the closing of the loop. When it was to be built, they told us you could use it for road material, the ash. But DEQ would never allow it, and maybe I wouldn't feel real good about it either, I don't know. But it's inert, it's sterilized. So anyway, those piles aren't growing anymore. And I'm just awful happy about it. And there's even some possibility we'll be able to go into the older material and take it down and not be such a burden on Woodburn and just piling up this material. So that's good news. Now this is where the bad news, so things change. We find out that they haven't really been recovering as much metal as they thought. So I'm kind of dedicating myself to get to the bottom of that. I know some equipment hasn't shown up yet, and we're going to do better. I really want this to work because it's an important one. And then the other things where things change, our contract with Covanta is up next year. And we've been in negotiations with them, and it's kind of hard. They kind of feel like it's their plant. Well, it kind of is, but in reality, Marion County built it and paid for it, and they should have just been operated. There was tax strategies is why they own it. But we've been partners, and good partners. We provided the material, we take the ash, and we've used electrical sales up to recently to pay those bonds back and pay for the plant. Luckily, we had those, and that's a primary source of revenue that we're using to fix Courthouse Square. But anyway, it's going away. So that contract's up. We're negotiating a share of those electrical revenues. In the first meetings with PGEs, tell us that times have changed. You would think, wouldn't you think there'd always be a need for electricity? Well, it's not such big demand now. And the rates they're proposing are about half of what they were under the original contract. So it's a disappointing time, but there's a lot of opportunity, and I can say it here. It's kind of why I ran again, because I could see it. I wanted to be involved in how this turned out, so it'll be important to me to get some good answers. So thank you for not yawning. I didn't give you too much material. It is a very, very fluid thing with the county. It's interesting. It's mostly rewarding, and thanks for letting us be here, Jennifer especially. Chamber wouldn't, I guess he got tired of us. They wouldn't put us up, and I appreciate so much this opportunity. Like I said, we want to get out to communities, just like internal. There's where we learn what people need, and we'll make ourselves available.
And are you taking questions?
Yeah, now it's time. I don't have answers, that's I shouldn't say that.
Well, specifically children and families, I noticed that Easter Seals Children's School in West Salem, certainly not Marion County, but certain Marion County is closed. And as a father, that adopted parent who needed those services at the time, there were only 2 facilities in the whole Salem area that offered those. Catholic Children's Services and Easter Seals, and now one of them got away. We were on a waiting list for children that came into our house immediately and needed help immediately.
So they transferred you to someone else?
No, this was back then,
Okay.
and fortunately, Easter Seals was able to get us in, and all 5 of our adopted children have got tremendous benefit from them, and now they're not there. And based on the earlier conversation concerning drug abuse and parental abuse, spousal abuse, child abuse, those needs are still going to be there. Is there anything the county's doing to maybe draw somebody else back into that?
Well, I think that's going to come under the purview of these hubs that haven't been developed yet, so it does indicate a gap. We still have, Commissioner Carlson is one who I would turn to as the expert on children and families and where things are going, so I might have her. But Allison Kelly, our Children and Families Director, is someone else to talk to. And if there's something specific, I can just pass it on or just ask you to contact them if you have questions or need help.
I just know we got a terrific need, and I'm sure that need hasn't gone away.
No, that was my point entirely. Nothing's changed other than, I don't know, they just want to go to Karen.
And maybe Commissioner Carlson would be the person to ask, but question has to do with the incoming in 2014. And we'll I'll call it affordable, the Obama's in health, affordable health care. And I learned from somebody who's an insurance person who said, and that I've now gone on the site, that Oregon is developing a program called Cover Oregon, and we're going to be sort of I don't know if we're a pseudo pilot or something to implement this program, and we're going to have a little quasi-state agency that's private, public, to run. So I'm trying to learn information about it, but not too many people know, as far as I can tell, much about it.
Oh, yeah, we're looking at one.
Is
I have
that
to
the
tell
right
you, Karen,
one?
this is the most divisive issue that came before us as commissioners, and one in real advocate position, one trying to get along position, and one totally opposed position. And I don't know the answers. It's very, very similar. In fact, it's the same strategy as these hubs. The state taking over a division, and I don't know, and I'm going to let Patty answer because from the opposition, I wanted different issues than what people think. It came down to whether the county wanted to be involved on the CCO on this board. We have responsibilities, especially in mental health, but the dollars no longer come through the county. So my position was, we at least need to have a seat at the table to represent those people who we're responsible for. But it's not a great seat. And Patty, you've got more, I'm sure.
Yeah, oh gosh, I feel
I
like
don't
Commissioner
think
Cross, I'm going to have to leave here in just a minute. The short of it is, the coordinated care organizations that are now up and running in Oregon, they are it is the, we might say, precursor, it's the implementation of the Affordable Care Act, which is often referred to as Obamacare. Every state in the union has to implement Obamacare by January of next year. Most every state is doing something. Oregon is doing these coordinated care, and then you hear about the insurance, the exchanges where people can buy health insurance. The reason I have tremendous concerns about all of this is the money is not there, it hasn't been there, and it won't be there. It's that simple. If the discussion were solely about the individuals who are on the Oregon Health Plan, and I think everybody, we have a duty to help those who can't help themselves. That's what the Oregon Health Plan is for. So I don't want to be misinterpreted on that. If the discussion were solely about cutting costs for those patients on the Oregon Health Plan, how can we reduce the cost to the state, I think we would be having a totally different conversation about where improvements to health care can take place and how it would happen. The community care organizations, the first patients, as Commissioner Carlson said, are those individuals on the Oregon Health Plan. The next group in are what they call PEB, those are the public employee and retirees. The next group in will be, and this is true, I'm not making this up, it will be. The next group in is all government employees. That would include teachers, it would include county employees, state employees. The next group in is everybody. Governor Kitzhafer's vision is that and there's a bill that I was hearing, that outlines the future of health care in Oregon. And the language says, everyone who lives and works in Oregon will be in this health care plan. So that's the goal. It's not just about those people on the Oregon Health Plan. So that's the short of it. Again, my major concern is the money to even start the CCOs up was not there. It's not going to be there. And there's a lot of data. I have piles and piles. I've done a lot of research on all this, and the money's not there. Even if everybody in the United States ends up in the single-payer universal system, which that is the goal of many, many people, there's not enough money. So what happens? You have three things. You have the number of people in a plan, you have the cost of the plan, and you have the quality of care. So if the money's not there, what happens either to the number of people? Well, everybody's in the system, so what happens to the quality of care? Then you start talking about, which I think probably most everybody in this room, you have a relationship with your doctor and some other healthcare providers. All this new system destroys patient-physician relationships. They won't be. And the other trend that many people who are following this are very concerned about is there will not be private practice doctors because you can't afford to run a private practice. So many people are saying, well, what choices are left then? Well, everyone is a government physician. What happens then? Then all these government physicians and healthcare providers become union members. Can you imagine the cost there? The legislature right now is struggling desperately with PERS in the public employee retirement system, and of course we have a lot of state and county employees on the public employee retirement system. You have teachers and all kinds of educators. So those are just some of the major concerns that are out there, issues that have to be addressed if we're going to truly improve health care.
All right, any non-controversial questions?
Who's going to win the NCAA?
Well, my Dukesters didn't look so good. So. Okay.
Okay.
I'm picking Louisville.
Pardon me?
I said I'm picking Louisville.
Oh, Louisville.
There you go.
Oh,
We got a limb there.